Bonjour, bienvenue à cette conférence de presse. Je m'appelle Guillaume Saint-Pierre et je serai votre modérateur. So with us today we have Senator Stan Kutcher, Pamela Wallin, and Marie-Françoise Mégie. Senator Kutcher and Mégie will start with statements for about 8 minutes, and then we will open it up to questions. Senators.
Thank you. Could we just get the translation here?
Is it not working?
I don't hear anything.
I don't know. I will just speak and see if it's picking up that in your microphone. Put it up to, yeah?
Just want to see.
Okay, I hear an English voice. Is that
OK.
French to
Et
English?
si je parle en français, est-ce que c'est traduit en anglais? Est-ce que vous m'entendez?
Which is the channel for English and which is the channel for French?
Should be one or two.
Yeah, we're
Okay.
just not getting
Alors,
any sound. Oh, there we, okay, try again.
Bienvenue à cette conférence de presse.
So
Okay, great. Thank
which
you.
is
Parfait.
which is the French? Which is the English? One or two?
Madame Wallin?
One is the English, I believe.
Okay, so,
One English, two French.
okay,
Thank you.
perfect. Okay, good to go.
Thank you, everybody, for being here. Before we begin, I would just like to apologize that for my cough. I may cough sometimes. It's not COVID. It's been 2 months now of a cough, and I think it's probably a good idea for me to see a doctor about it.
Do you know any?
Yes. Marie-Françoise. Good morning, everyone. Thank you very much for taking the time to be with us today to talk about the report of the Special Joint Committee on Medical Assistance in Dying, where mental disorder is the sole underlying condition, MAiD, MD-SUMC. We understand that this is a deeply personal topic and an issue that may be challenging for some. We're also aware that many Canadians hold strong opinions about this issue and that there has been much misinformation about this that has impacted on public discourse. We are also aware that there are some Canadians whose lives are dominated by unrelenting suffering who wish to apply for MAiD and who have been expecting that they would be able to do so this March. Today we'd like to talk about the charter rights of all Canadians to be able to equally access health care, including end-of-life care, the final report of the MAiD committee, and ultimately why we wrote a dissenting opinion. My name is Stan Kutcher, and I'm an independent senator representing Nova Scotia. I'm a psychiatrist with over 30 years of experience working across Canada and globally. I'm accompanied by Senators Marie-Françoise Mégie, who is a family physician and a palliative care physician, who represents Quebec, and Pamela Wallin, who needs no introduction to this audience, who represents Saskatchewan. We believe that the majority report of the committee, if accepted by the Government of Canada, will deprive Canadians with mental disorders of their charter rights regarding end-of-life care by discriminating against their right to apply for MAiD. We strongly object to the process by which the committee conducted its work and vehemently disagree with the conclusions of the majority report. Simply put, we think that the committee failed to respect its mandate. It failed to accurately represent the weight of witness testimony, and ultimately, it failed to uphold the charter rights of all Canadians. Prior to the committee meetings, the Government of Canada had identified 4 readiness tasks that it required be addressed prior to moving ahead with amending the criminal code to decriminalize MAiD, MD-SUMC. Number 1, that an expert panel on MAiD and mental illness be commissioned and issue a report. That was completed on May 13th, 2022. That revised reporting regulations be developed for enhanced data collection. This task was completed by Health Canada well prior to the meeting of the Joint Committee. Then an accredited training program addressing MAiD for physicians and nurse practitioners be developed and made available across Canada. The training program is complete. It has been accredited by the Royal College of Physicians and Surgeons of Canada and by the College of Family Physicians of Canada, and is being rolled out across this country. And 4, that model MAiD practice standards be developed for consideration by the medical practice regulators in each province and territory. This also was completed prior to the joint committee meetings. Bill C-639 extended the exclusion period for MAiD, MD-SUMC, because all the readiness tasks that the federal government had required to be completed had not been completed at that time. So an additional year was provided to ensure that these tasks, as required by the federal government, had been completed. As I have just enumerated, all the tasks required by the federal government for readiness were completed well prior to the meetings of the Joint Committee. The committee was mandated to assess readiness as identified by the Government of Canada. It heard testimony from 21 individuals and organizations. 15 of these witnesses participated in one or more of the readiness tasks that had been required by the federal government. All 15 of these witnesses testified that these tasks had been completed and that therefore the exclusion could end on March 17th, as outlined in Bill C-39. Despite most witnesses asserting readiness had been achieved, the majority report of the committee states, quote, "The medical system in Canada is not prepared," end quote, and recommends that the exclusion continue. It disregards the fact that all of these Government of Canada required readiness tasks were actually completed more than 4 months prior to the deadline of March 17th. The majority report says, quote, "The medical system in Canada is not ready." Well, the committee did not study the medical system in Canada. It can therefore make no comment on something that it actually did not study. Furthermore, the majority report's conclusion ignored testimony from the 15 witnesses who had actual knowledge about the readiness tasks and was based on the testimony of only 6 witnesses, none of whom had participated in the development of the readiness tasks required by the federal government, and none of whom could determine if the medical system in Canada was or was not ready. Now I'll pass it over to Senator Mégie.
Merci. Bonjour à tous. Pour faire suite aux propos du sénateur Kutcher, nous pensons que le rapport majoritaire n'a pas rempli son mandat et qu'il ne reflète pas fidèlement les témoignages et le poids des preuves entendues. Notre opinion dissidente note également que le rapport majoritaire n'a pas pris en compte les témoignages essentiels soumis sous forme de mémoire par des experts responsables de la prestation des services d'AMM dans certaines provinces du Canada. Des mémoires clés en réponse à l'appel ouvert du comité ont été lus lors des réunions du comité, mais ces mémoires ont été ignorées et ne sont pas mentionnées dans le rapport de la majorité. Chacun de ces 4 mémoires indiquait clairement que les prestataires de services d'AMM de ces provinces étaient prêts à aller de l'avant. Nous pensons que les Canadiens souffrant de troubles mentaux devraient recevoir également des soins de santé au cas par cas, un droit qui est accordé à tous les autres Canadiens qui remplissent les critères pour demander l'AMM. Selon nous, le rapport majoritaire stigmatise et discrimine les personnes atteintes de troubles mentaux et perpétue le mythe selon lequel les personnes atteintes de troubles mentaux sont incapables de prendre des décisions éclairées quant à leur choix de fin de vie. Nous encourageons tout le monde à lire l'opinion majoritaire et notre opinion dissidente. Nous avons également des ressources dans les dossiers de presse disponibles pour les journalistes qui recherchent des lectures supplémentaires ou des sources bien informées pour leurs articles. Vous pouvez contacter l'un de nos bureaux pour recevoir ces informations. Merci.
We'll now open up the floor to questions, and Senator Wallin and I are happy to take any questions in English, and Senatrice Mégie is happy to answer questions in French, although with simultaneous translation, we welcome each other's input, regardless of what language the question was put.
Okay, so we will go to questions. We will start with Kate McKenna, CBC.
Good morning. Reporting by Radio-Canada suggests that the government now will not pursue MAiD for mental disorders, a sole underlying condition, until after the next election. I'm just wondering, what do you make of that decision to not pursue this in the current mandate?
Well, I think it, in a sense, speaks for itself that this has become a political decision. This is a government for whom choice has been a mantra. Choice on gender, choice on abortion. MAiD is precisely the same issue. This is a question of choice and people asking for the ability to seek medical assistance in dying. So I find it shocking that obviously on this one particular issue, they no longer subscribe to the notion of choice and how important that is. So it leads me to believe, and others who are, I think, looking a little bit more in depth at our words and our reports, that there has been an about-face on the part of the government on this issue, that they, or perhaps they were disingenuous from the beginning. I don't know how else to put it. They led people to believe that MAiD was going to continue to be available for people. They made a specific choice on this one when the Senate actually voted in favor of pursuing the notion of advance requests. The government itself said yes to an option for MAiD for those where mental illness is the sole underlying condition for the request. So they created hope for people, and I believe now have dashed it.
Can I have a follow-up? Yeah? Okay. Given the polls and the Conservatives' objection to this policy, do you think that this could be the end of the possibility of MAiD for mental disorders, a sole underlying condition in Canada?
Yeah, go ahead.
The issue here is, our Canadian governments, regardless of their political stripe, prepared to uphold the Charter. And in our opinion, this is fundamentally a Charter issue. All Canadians, regardless of where they live, who they love, what illness they have the same rights. And this goes for people with a mental disorder, as well as for people who don't have a mental disorder. To discriminate against a group of people in terms of their wish to be assessed for MAiD just does not follow the Charter. So the question here is the government willing to stand up and to follow the Charter rights? And it doesn't matter which government is in power. We have to follow the Charter because this is the framework that the rights and freedoms of Canadians are guided by.
Yes, that is the point, that this is a Charter issue. There have been at least 3 cases on this particular issue of access and constitutional rights of all Canadians, regardless of their status for access. So you do have to wonder if when governments decide that they will delay an issue until some unspecified time in the future, presumably after the next election, you have to wonder if there is some intent to shift blame and responsibility if there is another government elected. I suppose if this one is re-elected, they would then have to deal with that issue themselves about the key questions of choice and charter rights.
Cette volonté de pelleter par en avant, nous l'avons clairement remarqué lors des entrevues en comité. C'est-à-dire que même quand les témoins nous soulignent la notion d'exclusion, la notion de discrimination, ça revient quand même ah, ben, on n'est pas prêt, oh, on n'est pas prêt. Alors que les témoins, les organismes réglementaires, ceux qui ont été chargés de respecter la demande du gouvernement du Canada, c'est-à-dire de vérifier est-ce que les organismes réglementaires ont tout prévu pour que l'aide médicale à mourir soit donnée dans de bonnes conditions, une bonne évaluation pour les évaluateurs et la bonne administration de ces soins par ceux qui donnent les soins, mais malgré tout, tous ces prestataires de soins nous disent « nous sommes prêts ». Mais on sent que la réponse et les autres questions qui ont été posées et ont été soulevées, c'était comme « mais on n'est pas prêts ». Donc, c'était comme, eux, ils disent qu'ils sont prêts, ils sont les témoins, mais ceux qui questionnent, mais on n'est pas sûr que vous êtes prêts. Donc, c'est pour ça qu'on pense que l'intention était justement de pelleter la décision pour plus tard à quelqu'un d'autre.
Sarah Ritchie, CP.
Senator Kutcher, I know you worked quite closely with the former Justice Minister on the amendment to the original bill that would have allowed for this expansion. Do you think that we would be in this position if David Lametti was still Justice Minister?
I don't know the answer to that question, frankly. But I do know from what Mr. Lametti has said previously that he felt quite clearly and quite strongly the continued delay of access to MAiD by individuals whose sole underlying condition is a mental disorder was against the Charter. And that was his opinion. So, when we look at actually how this evolved, we've had the Carter decision, which did not discriminate against people with a mental illness. It also allowed people with a mental illness to approach the courts for relief. And that happened in Alberta. And the government of Canada actually brought a suit to stop that process in Alberta and lost. A unanimous decision in the Alberta Court of Appeal. And then, based on C-14 being exclusionary, there was a case brought in the Quebec Superior Court, the Truchon decision, which looked very carefully at all aspects of mental illness and concluded that people with a mental illness had the same right to MAiD as everybody else did. And then the Canadian government did not appeal that decision either, which makes me think, and I don't know for sure, I'm not a lawyer and definitely not a constitutional lawyer, that they didn't appeal because they knew that they would lose. So I don't see anything changing on this particular issue. And frankly, I think many of the arguments that have been brought forward against moving on MAiD really are arguments that have tried to put into place reasons for not going ahead with charter rights. And many of those arguments are problematic in their own right. But there was then something interesting that happened right after the Joint Committee report came out. And I started to receive emails and on my Twitter thread rejoicing that this had happened, with people saying, MAiD is next. What we're going to do now is take our victory and make sure Canada gets rid of MAiD, period. Well, we're seeing this across the board in the world. Roe versus Wade was overturned in many American states, and we're seeing the horrible negative outcomes of that. So I think that part of the attack, the vicious attack on individuals who are suffering from a mental disorder to exercise their constitutional rights to apply for MAiD, not receive it, but just to apply for it, is part of this backlash that happened. It's happened in Canada over and over again. Remember, this is the federal government's responsibility is not to deliver health care. The federal government's responsibility in this was to amend the criminal code to allow this type of end-of-life care to occur. What has happened here is not, this has happened before in Canada. It happened with contraception. It wasn't until 1969 that if you used the pill or a condom, for controlling pregnancy, it was a criminal act. Abortion was a criminal act. Those were decriminalized. Making love to a same-sexed person was a criminal act that was decriminalized. What we're talking here is the same thing. This is the federal government's responsibility. It's the decriminalization of the criminal code. Provinces and territories can choose to deliver their health care however they wish to deliver it. They do that now anyway. There are some provinces in which abortions are not as equally accessible as in other provinces. There are some provinces where particular medical procedures are not performed and people have to go to other provinces to get them. This is already common in Canada's healthcare system. What we're seeing here is a government failing to uphold the Charter of Rights of all Canadians. And I don't care what government it is. If Canadian governments don't uphold the Charter of Rights of Canadians, we have a problem.
It also puts a real undue pressure on individuals. All of this issue has actually been settled by the court. The Supreme Court, in its original decision, left this pretty clear that it was a constitutional right and a choice. But now what we're seeing is Canadians, time after time after time, having to go to court and pay the costs. It is not an easy process to go through any level of court or to take it back to the Supreme Court to fight for what has already been decreed a constitutional right in this country. So to keep shifting the cost and the time and the responsibility and all this back onto the backs of people who are in need, who are waiting, who were promised some relief from their illness, from their circumstance, or at least the right to seek some relief, like other Canadians. I think that this is just, honestly, I think it's cruel and unusual punishment for Canadians who have a constitutional right.
Based on what you have seen in terms of the way the rhetoric around this has shifted over time, is it your belief or your understanding then that this, what you're framing as a question of a constitutional right, has been hijacked by groups who do not want MAiD to exist in this country at all?
I don't know if you want to use the word hijacked, but I think that there are groups and individuals in this country who have used this issue to promote an underlying disagreement that MAiD should exist. So if I, for example, look at one of the arguments that the majority report put forward why we shouldn't go ahead on this, it was the issue of consensus. They argued that there was no physician consensus on MAiD, MD-SUMC. But demanding consensus from physicians on this issue is an example of discrimination, prejudice, and stigma against people who are suffering intolerably from a mental disorder. Nowhere that I know of in medicine, and I would ask Senator Mégie to comment on this as well, is there consensus necessary to deliver health care? There's actually no consensus amongst physicians on MAiD in this country. Also, for example, let me just give some other examples on this. There's no consensus amongst physicians whether women in their 40s should be receiving an annual mammogram. That doesn't stop that from happening. There's no consensus amongst physicians in this country about the provision of safe injection sites. Yet this government supports that. There's even no consensus amongst doctors that contraception should be used. There was an article in the Ottawa Citizen just a few years ago that talked about a group of physicians who refused to even give patients information about contraception. And the Cleveland Clinic last year published patient guidelines on what to do when doctors disagree. This happens all the time in medicine. So the question that I would ask us to really focus on is, what does this mean, demanding consensus from all physicians about MAiD MD-SUMC? It's discriminatory. Nowhere else in anything that we do in medicine do we not allow individuals to access medical care because there's no consensus amongst physicians. So this, again, discriminates. Setting this up as a criteria discriminates against people who have a mental disorder, which leads to a denial of their charter rights.
Yeah.
Je voulais continuer avec le point sur le consensus que le sénateur Kutcher a soulevé. Je me souviens au tout début, quand en 2015, les discussions commençaient sur l'AMM en général, il n'y avait pas de consensus. Il y avait beaucoup de professionnels de la santé qui étaient vraiment campés d'une part et d'autre. Et cependant, il y a eu beaucoup de pression. Je me souviens même une DSP qui a dû envoyer des lettres à tous les médecins disant « Je ne trouve personne pour faire l'AMM dans mon milieu et je suis obligée de le faire. Donc, débrouillez-vous, organisez-vous avec des petites menaces déguisées pour leur dire « J'ai besoin de monde. » Donc, ça veut dire que dans son milieu, il y en a quand même qui ne voulaient pas. Donc, c'est au fur et à mesure que maintenant, les gens connaissent plus ça. Peut-être qu'il y a beaucoup plus de professionnels qui se sont engagés dedans. Donc, si on attend le consensus-là, je pense que c'est un prétexte pour changer le problème de place.
Okay.
I'm just wondering if you could clarify why, in your opinion, the Supreme Court doesn't need to rule specifically on mental disorders or the constitutionality of MAiD for mental disorders, because it didn't rule on mental disorders specifically in the past.
Why would one expect it to rule specifically on mental disorders is the question that I would ask. That question is a form of discrimination right away. I'm not saying that you're discriminating, but I know that has been out there. The court ruled that all Canadians, regardless of who they are, have the right to access health care equally. And as I said before, the Alberta Court of Appeal ruled in a person who had mental disorder as the sole underlying condition that they had the constitutional right. And again, the government did not take that to court, did not appeal that, and same with the Truchon decision. So we've had clear rulings. To expect the Supreme Court to say, oh, in addition, by the way, we're going to make sure that people with mental illness can be discriminated. They didn't do that because that was not what they were doing. They were looking at all Canadians. And the judge in the Truchon decision made it very clear, very clear. You can't discriminate people on the basis of a diagnosis. You have to look at it by a case-by-case basis. As long as the individual meets the criteria, they are to be treated equally.
This is the same decision we've seen on advance requests, right? Again, it should not have to be a separate category for people who may have been diagnosed with dementia or Alzheimer's. It's illness is an illness is an illness. And they have, it goes beyond, the charter rights include all of that. All Canadians have charter rights.
Je voudrais ajouter quelque chose par rapport à ce qui est revenu souvent en comité, parce que le préjugé, c'est que les personnes avec maladie mentale ne peuvent pas prendre de décision, alors que dans le plan qu'on est en train de monter ou qui est déjà monté et qui est déjà prêt et les prestataires de soins commencent à recevoir la formation nécessaire pour. Dans cette formation-là, il y a des modules qui soulignent comment évaluer, autant qu'il évalue le risque suicidaire, autant qu'il évalue la capacité de décider. Et cette capacité de décider, les professionnels de la santé ont déjà de la formation pour, dans d'autres situations, pas seulement dans l'AMM. Donc, ils savent comment faire pour aller chercher la capacité de décider de quelqu'un.
Sir, okay, one more question. Sir Ritchie.
Thanks. It seems that the government is going to introduce its legislation to delay this expansion imminently. What will happen when that legislation comes to the Senate?
I can't predict that. Yogi Berra, my favorite philosophy, said predictions wouldn't be so hard if they weren't about the future. Actually, I want to come back to that issue if I can. But we have a bicameral parliament here, and the Senate is the place of sober second thought. And there's historical precedence in the Senate for addressing some of these issues differently than the House addresses them. Also, the Senate, one of the reasons that it was created was to protect against the tyranny of the majority. So I expect that if and when the bill that the government introduces comes to the Senate, it will be the role of the Senate to have a careful, thoughtful, sober second thought look at this legislation, just like we do with all types of legislation. And we will study it, we will debate it, and then we will vote.
Any other comments? Okay. Alors, c'est ce qui me fait la conférence de presse. Thank you very much, everyone.